Good evening, everyone, respected professors and my juniors. My name is Dr. Aaditi, and I have been working here as a GR in anesthesia department for almost an year now. I have recently passed my Plab Part 1, and I am due to pass my Part 2 in August. I'll be briefly talking about USMLE and Plab. So, can I first get an idea of how many of you know about USMLE or Plab here? And is there anyone who is preparing or has cleared any part? No, okay, not a problem. So USMLE is a licensing exam for US, and Plab is a licensing exam for UK. USMLE is held in 3 steps: step 1, 2 and 3. We shall not talk much about step 3 because it can be taken later also. After you start your PG in US, you can take a step 3. But step 1 and step 2 is, you can take it in India, and it's a MCQ based paper. Step 1 includes your syllabus of first and second year. Step 2 includes syllabus of third and fourth year. So an ideal time to give step 1 is after you pass your second year, and for step 2 is after you pass your fourth year. But generally students take it after fourth year, step 1 and step 2 altogether. After you clear step 1 and 2, you have to give an English test, OEP, Occupational English Test. Once you have results of these 3, you can apply for ECFMG certification, and then you take ahead. You have to apply for interviews. So here we give NEET PG, and then a counseling is held, and you are allotted rank, and then you are allotted a college. Then you have to face an interview. So you have to build a portfolio. Portfolio is does not only include your marks of exams, but not many other things, right? Okay. Now I'll be talking about Plab and why I chose Plab over USMLE. So in USMLE, if you do not match and you do not go into residency program is basically doing PG there. So you have to come back to India. You have no other option to work or practice as a doctor in US. But in Plab, it's simply a licensing exam where you get a license to practice in UK. So if you do not start your PG straight after Plab, you can take your time, practice as a JR in UK, understand their system, and then apply for interviews or for PG programs. So Plab starts from the English test. The first step is English test. So you can give either IELTS or OET. I gave OET and passed it in my first attempt. You have to get band B. So it's taken in 4 parts: listening, reading, speaking and writing. After you have your result of OET, you can book your Plab Part 1. Now Plab Part 1 is a MCQ based paper which has 180 questions, 180 minutes and no negative marking. Now these 180 questions are totally clinical based, so majorly it includes the third and fourth year subjects. So by clinical questions, I mean those are clinical vignettes. So even if they want to test your anatomy knowledge, they'll be asking a clinical scenario in which they'll test your anatomy. And you don't have to extensively study microbiology and biochemistry, so I really like this exam. After passing your Plab 1, now Plab 1 is again a pass or fail exam. It does not give you a rank, or it gives you your score so that you can judge yourself, but it doesn't matter. So this time the passing mark was 113 out of 180, and if you score 140 or you score 170, it doesn't matter. Nobody will come to know your marks, and it never matters. It's just a step that you clear, and you can book your Plab 2. Now Plab 2 is an OSCE exam. So OET and Plab 1 you can give in India, but Plab 2 has to be given in UK. You have to go there. You have to prepare for Plab 2. Now these exams are really expensive. So I'll tell you, Plab 2 cost you somewhere 90,000 just for the form, just for sitting in the exam. and then preparation is a whole different story. So in Plab 2 you have 16 stations. In 16 stations, basically you go to the 16 different rooms and different scenarios are there. You have to either take your clinical history, or you have to do an examination, or do a counseling, or it can be anything. You're prepared for it. Now the good thing about these exams is that the exam pattern is pretty much fixed. It's fixed, and you don't have to give a lot of time. See, I am a MBBS batch 2013, 2013. So and after giving 2 attempts of NEET PG, I didn't score well, and I started pretty late about Plab. I had no idea. I just went to the YouTube and I searched options, and I got this Plab, which sounded to me much better than Usmle at this point of time, because already I wasted 2 years after my internship. So just 20 days for OET is pretty good. My mistake and my advice to you people is that generally an ideal time, I'll say, an ideal time to give OET is at the end of your 4th year. It takes only 20 days of preparation. And for everything, you'll have materials free of cost on Telegram. You can freely download them, take a look, practice just 20 days. And it can be done with your studies or any time. Just 20 days is not a big thing. And for Plab 1, I took 2 months. Now 2 months are not sufficient, I would say. I mean, if you have time, you take your time, but it can be done in 2 months as well. And for Plab Part 2, which is an OSCE exam, you go to the UK, you have coachings there. A 12-day coaching is sufficient, and then a month of practice with the other fellows, and then you can crack Plab 2 as well. And after you give your Plab exams, you have to apply for license there to practice as a JR. You can apply for the jobs, do job, learn from there, build your portfolio and take it ahead. My advice for everyone who wants to take this kind of exam is that do not just only focus on your scores and your knowledge. Also take time to get involved in other activities. Like this Pragyanshala is a very nice initiative. If you can get involved into some research work, that is really good for your portfolio. You have professors who are always looking for students who can collect data for their researches, so get involved. We have certification courses going on, BLS, ACLS, so get certified and take up some leadership roles. And everything matters, even a distinction certificate, poster presentation, everything matters. It adds up to your portfolio. So if you can do anything that is a start to your portfolio, just keep doing. Keep doing. You have enough time. You have 4.5 years here. And also for the people who are attending clinical postings and my interns, I would say do not waste time. If you think that when you go in the posting and there are a lot of people, you cannot study properly there, or you cannot learn, take your time in the evening. This is a hospital, this is a campus, you are living in the campus, you have enough resources here, you can take your time anytime, come to the wards, learn from the SRs and JRs, or anyone you have, even from the nurses. I as a JR in anesthesia, have learned a lot of things from the nurses here. Take your time and keep learning, do not waste it. And about the interest thing, I would say, when you do things, you build your interest. A lot of times this happens. I had no interest in anesthesia as such, but now when I work in anesthesia, it just gives me a good adrenaline rush. That's it. Thank you.